as the largest and one of the most important organs of the body, the skin is the body's first line of defense against disease, protection the organs, and creates a barrier to the environment. Dermatology is a branch of medical science that pertains to the study of the skin, its nature, structure, function, disease, and treatments. A dermatologist is a physician who specializes in treatments of the skin, hair, and nails. Healthy skin is slightly moist, soft, and flexible with a smooth, fine-grained texture. The slightly acid pH of the healthy skin provides a protective barrier against organisms that touch or try to enter it. Ideally, the skin should be free of blemish and other disorders and have the ability to renew itself. Skin varies in thickness over different parts of the body. It is thinnest on the eyelids and thickest on the palms of the hands and soles of the feet. Continued pressure over any part of the skin can cause it to thicken and become calloused. A callus is a part of the body's natural defense system and should not be removed, as it will generally return thicker and harder. The skin of the scalp is constructed similar to the skin elsewhere on the body, but the scalp has larger and deeper hair follicles to accommodate the longer hair on the head. The appendages of the skin are hair, nails, sweat glands, and oil glands. The skin is constructed of two clearly defined divisions, the epidermis and the dermis. The epidermis, also known as cuticle or scar skin, is the outermost protective layer of the skin and is the thinnest layer of the skin. The epidermis contains no blood vessels but has many small nerve endings. The layers or strata of the epidermis are as follows. The stratum corneum or horny layer is the outer layer of the epidermis. This is the layer we see when we look at someone. It consists of tightly packed scale-like cells that are continually shed and replaced by cells coming to the surface from underlying layers. These cells are made up of fibrous protein called keratin, which combines with a thin layer of oil sebum to help make the stratum cornea a protective waterproof layer. The stratum lucidum, or clear layer, lies beneath the stratum corneum and consists of small transparent cells through which light can pass. The stratum granulusum, or granular layer, consists of cells that look like distant granules and are filled with keratin. These cells are almost dead and are pushed to the surface to replace cells that are shed from the stratum corneum. The stratum spinosum, or spiny layer, often classified as the germinidivum, is a sublayer that lies above the basal stratia and beneath the stratum granulusum. The process that causes the skin cells to shed begins in this layer. The stratum germinativum, also known as the basal cell layer, is the deepest layer of the epidermis. This layer is responsible for the growth of the epidermis. It also contains the melanocytes, which produce a dark pigment called melanin, which protects the sensitive cells below from the destructive efforts of excessive exposure to ultraviolet light. The dermis is the underlying or inner layer of the skin. It is called the derma. The dermis is about 25 times thicker than the epidermis and consists of a highly sensitive vascular layer of connective tissue. Within its structure and numerous blood vessels, nerves, lymphs, and oil glands, hair follicles, erector pillar muscles, and papilla The dermis consists of two layers, the papilla or the superficial layer and the rectangular or deeper layer. The papillary layer lies directly beneath the stratum granulusum of the epidermis. It contains small cone-shaped projections of elastic tissue called papilla that points upward in the epidermis. Some of these papilla contain loop capillaries, which are small vessels. Others contain small structure called tactical corpuscles with nerve fiber endings that are sensitive to touch and pressure. The layer also contains some melanin, skin pigments. The space of the top of this layer is epidermal, dermal junction, where the two layers meet. The rectangular layer is the deeper layer of the dermis, which supplies the skin with oxygen and nutrients. The rectangular layer contains the following structures within its network: fat cells, sweat glands, blood vessels, hair follicles, lymph glands, irradicular muscles, oil glands. Subcutaneous tissue, also known as adipose tissue, is a layer of fatty tissue found below the dermis. Subcutaneous tissue varies in thickness according to age, gender, and general health. It gives smoothness and counterbody, contains fat for use as energy, and also acts as a protection cushion for the outer skin. Fluids of the skin. Blood and lymph supply nourishment to the skin in the form of protection and fat. From 1/2 to 2/3 of the body's blood supply is distributed into the skin. As the blood and lymph circulate through the skin, they deliver essential materials for the growth, nourishment, and repair of the skin, hair, and nails. Networks of arteries and lymphatic in the subcutaneous tissue send their smaller branches to the hair papilla, hair follicle, and skin glands. Nerves of the skin. The skin contains the surface ending in many nerve fibers, which are classified as follows. Motor nerve fibers are distributed in the erector pillar muscle attached to the hair follicles. This fiber carries impulse from the brain to control muscle movement. Sensory nerve fibers react to heat, cold, touch, pressure, and pain. These receptors send messages to the brain. Secretory nerve fibers are distributed to the sweat and oil glands of the skin. Secretory nerve regulate the excretion of perspiration from the sweat glands and the flow of sebum from the oil glands to the surface of the skin. Sense of touch. The papillary layer of the dermis house of the nerve ending that provide the body with a sense of touch. These nerve endings register basic sensations such as touch, pain, heat, cold, pressure, or deep touch. Nerve endings are most abundant in the fingertips. Complex sensations such as vibrations seem to depend on the sensitivity of a combination of these nerve endings. Skin color. The color of the skin, whether fair or dark, depends on the genetic melanin. Melanin, however, is the primary source of skin color. These grains of pigments are deposited in the stratum granulusum of the epidermis and the papillary layer of the dermis. Special cells called melanocytes produce the pigment granules that are scattered throughout the granulusum of papillary layers. These granules are called melanosomes, and they produce a complex protein called melanin. Melanin, a brown-black pigment that gives skin color and serves as skin protective screen from the sun rays. The The amount and type of melanin is an inherited trait that varies among races and individuals. For example, dark skin contains more melanin than light skin. Skin elasticity. The skin gets its strength, form, and flexibility from protein fibers within the dermis called collagen and elasticity. Collagen fibers make up a large proportion of the dermis and helps to give support to many structures found in this layer. When collagen fibers become weakened, wrinkles and aging of the skin can occur. Elastin gives the skin its elasticity and flexibility and the ability to regain its shape after stretching. When healthy skin expands, it regains its former shape almost immediately. Controversially, one of the most prominent characteristics of aged skin is its loss of elasticity. The glands of the skin. The skin contains two types of duct glands. The Sudariferous glands or sweat glands and the Subcuis glands or oil glands, which extract materials from the blood to form new substances. The sudorific glands consist of a coiled base called a fundus and a tube-like duct that terminates at the skin surface to form the sweat pore. Practically all parts of the body are supplied with sweat glands, although they are more numerous on the palm, soles, forehead, and armpits. The nervous system controls the activity of the sweat glands, which regulate body temperature and help to eliminate waste products, salt, and other chemicals from the body. Regulations of the body temperature occurs when the evaporation of moisture from the sweat of the skin cools and body. Heat, exercise, emotion, and certain drug-influenced sweat glands activities. The subcuis or oil glands of the skin are connected to the hair follicles. These glands consist of little sacs with ducts that open into the hair follicle, where the hair secretes sebum, which lubricates the skin and preserves the softness of the hair. With the exception of the palms and soles, these glands are found in all parts of the body, particularly the face and scalp. Sebum is a semi-fluid oily substance produced by the oil glands that flow through the oil ducts leading to the mouth of the hair follicles. When the sebum becomes hardened and the duct becomes blocked, a blackhead is formed. The primary function of sebum is to act as a shield that prevents moisture from evaporating from the skin surface. Absorption level of the skin. Although the skin serves as a protection barrier against microorganisms and chemical absorption, some typical products and creams are designed to penetrate these barriers for medical purposes. Limited absorption occurs through the skin cells, hair follicles, subcuis glands, and Sudariferous glands, and allows for the entry of specialized drugs or chemicals into the body. For example, antiseptics may be used to reduce the risk of skin infections or vitamin creams used to support skin repair. The amount or level of absorption that takes place is dependent upon the thickness and location of the skin and the body, the concentration of the body, and the frequency of the application. Functions of the skin. The principal functions of the skin are protection, sensation, heat regulation, absorption, excretion, and secretion. Protection. The skin protects the body from injury and multitude of pathogens. The outermost layer of the epidermis is covered with a thin layer of sebum, which renders it waterproof. The skin is resistant to variations in temperature, minor injuries, some chemical substances, and many potential pathogens. The skin also provides protection for internal organs, arteries, veins, and bones. Sensation. The skin responds to heat, cold, touch, pressure, pain, and movement through its sensory nerve ending. Stimulation of a sensory nerve ending sends a message to the brain, which then stimulates a response. When you scratch, an itch, or pull away from a hot object, you are responding to stimulation of sensory nerve endings and the message that conveys to the brain. Some of the sensory nerve endings responsive to touch, pressure, lie in close relations to hair follicles. Heat regulations. Heat regulations is a function of the skin that protects the body from the environment. A healthy body maintains consistent terminal temperature of 98.6 degrees Fahrenheit, 37 degrees Celsius. As change occurs in the outside temperature, the blood and the sweat glands of the skin make necessary adjustments to facilitate the cooling of the body. Processes such as the evaporation of sweat to cool the body or the closing of pores to retain heat are examples of this adjustment and are regulated by in the brain. Absorption. Absorption beyond the top layer of the skin is limited but does occur. Some medications are designed to the entire body through the skin, where they are slowly absorbed and dispersed. Products designed for the skincare are not intended to be absorbed beyond the top layer of the skin. Excretion. Perspiration is excreted from the skin. Water loss preparation carries salt and other chemicals with it. Humans perspire 1 to 2 pints daily. Perspiration is made up of water, salt, and chemicals. Secretion. Sebum is secreted by the subcuis glands and lubricates through the skin and hair, keeping them soft, pliable. Sebum secretion is affected by hormones and emotional stress, which may increase the flow of sebum. Identify disorders and diseases of the skin. Although barbers are not licensed to perform treatments for medical conditions, providing facials and shaves are traditional service well within barber scopes of expertise. This includes addressing certain skin conditions such as oily or dry skin or minor acne conditions. Before proceeding with services, barbers need to be able to recognize different types of disorders to determine those that might be aggravated by facials or shavings, or those they may need medical attention prior to receiving services. Some skin and scalp disorders may be treated in cooperation with under the supervision of a physician or dermatologist. If asked to apply a medicine to the scalp, you must apply the medicine as directed by the physician, and the treatment should not extend beyond the number of applications or data indicated. To protect both the barber and client, the client should provide the barber with a copy of the prescription directions. If a client has a skin or scalp condition you do not recognize, refer the client to a physician. Lesions of the skin. A lesion is a mark on the skin that may indicate an injury or damage that changed the structure of tissue or organism. A lesion can be simply as a freckle or dangerous as skin cancer. Lesions can indicate skin disorders or diseases and may be symptomatic or other internal diseases. Being familiar with the principal skin lesions will help you to distinguish between conditions that may be compatible with services and those that need to be referred to a physician prior to the provision of services. Primary lesion of the skin are lesions that are different color than the color of the skin, or lesions that are raised above the surface of the skin. They are often differentialized by size, layer of the skin affected. such lesions may require medical referral. Hairy lesions are characterized by accumulation of material on the skin surface such as crust or scab, or by depression in the skin surface such as an euclear. There are several common disorders of the subcuis glands that the barber should be able to understand and identify. An open comedo, also known as a blackhead, is a hair follicle filled with keratin and sebum. Comedones appear most frequently on the face, especially in the T-zone, the center of the face. When the sebum of the comedone is exposed to the environment, it oxidizes and turns black. When the follicle is closed and not exposed to the environment, the sebum remains white or a cream color and is closed comedone, also known as a whitehead, and appears as a small bump just underneath the skin surface. Milia, keratin-filled cysts that appears just under the epidermis and have no visible opening. They resemble small sesame seeds and are almost always perfectly round. They are commonly associated with newborn babies but can appear on the skin of all people, all ages. They are usually found around the eyes, cheeks, forehead, and appear small white masses. Acne is a skin disorder characterized by chronic inflammation of the subcuis glands from restrained secretion. Acne occurs when obstetrical follicles are deprived of oxygen, which allows acne bacteria to multiply. Fatty acids obtained from sebum in the follicles are the main food source for acne bacteria. The bacteria multiply, causing inflammation and swelling in the follicle and eventually rupture the follicle wall. When the wall ruptures, the immune system causes blood to rush to the reticular follicle, carrying the white blood cells to fight the bacteria. An acne pupille is an inflammatory axine lesion resulting from the rupture of the follicular wall and the infusion of the blood. Acne conditions are rated in 4 grades. Grade 1, minor breakouts, mostly opens comedones, some closed comedones, and a few papules and pustules. Grade 2, many closed comedones, more open comedones, and more papules and pustules. Grade 3, redness and inflammation, and many papules and pustules. Grade 4, cysts with comedones, papules, pustules, and inflammation. A subcuis cyst is a large pocket-like lesion filled with sebum. Subcuis cysts are frequently seen on the scalp and the back and may be surgically removed by a dermatologist. Seborrheic dermatitis or seborrhea is a skin condition caused by inflammation of the subcuis glands and is often characterized by redness, dry or oily scalding, crusting, or itchiness. Excessive oiliness in the skin or scalp may also indicate the presence of seborrhea. The red, flaky skin often appears in the eyebrows and beard, in the scalp and hairline, at the middle of the forehead, and along the sides of the nose. Dandruff and cradle cap are forms of seborrhea. Dermatitis that are sometimes treated with topical creams. Rosacea, previously called acne rosacea, is a condition that appears primarily on the cheeks and nose. It is characterized by flushing, telangiectasis, and in some cases the formation of the papules and pustules. The cause of rosacea is unknown, but the condition of these thought to be genetic. Certain factors are known to aggravate the conditions in some individuals. These factors include exposure to heat, sun, and very cold weather. ingestions of spicy food, caffeine, and alcohol, and stress. Rosacea can be treated and kept under control by using medication prescribed by a physician, using proper skincare products designed for especially sensitive skin, and avoiding the aggressive flare factor listed above. Osteosis is a condition of dry, scaly skin characterized by the absolute or partial deficiency of sebum. It can be a result of old age, exposure to cold or alkalis, or body disorders. Steotomo, a subcuis cyst or fatty tumor that is filled with sebum. It is subcutaneous tumor of the subcuis glands that can range in size from a pea to an orange. A steotoma usually occurs on the scalp, neck, or back, and is sometimes called a wen. Acne treatment. Minor forms of acne can be treated without medical referral. Following are the basics of acne treatments. Daily use of gentle cleansers formulated for a specific skin type. The use of harsh cleansers can make skin too dry, and subcuis glands will generate more sebum, creating an even bigger problem. These foamy rinse-off products remove dirt, debris, and excess oil from the skin. Toners may be helpful for customers with excessively oily skin. Follicular efflorescents are leave-on products that help to remove cell buildup from the follicles, allowing oxygen to penetrate the follicles, killing bacteria. Commonly used ingredients in these products are alpha hydroxide acid, salicylic acid, and peroxide. Peroxide can be especially effective since it helps to shed cellular debris and also kills the acne bacteria. These products are generally used all over because of the drying properties and are only used as a spot treatment. Clients should be warned about possible allergic reactions of these products and should stop using them if clients experience numbness in the area, swelling of the hands, feet, or mouth. Use of a light moisture to keep skin balanced and reduce the skin of excess sebum production can be helpful. Identifying disorders of the Sudariferous glands. There are several disorders of the Sudariferous sweat glands that Barber should be able to identify and describe. Hyprodrosis is a deficiency in a perspiration or the ability to sweat, often a result of damage to autonomic nerves. This condition can be life-threatening and requires medical attention. Hyprodrosis results in foul-smelling perspiration, usually noticeable in the armpits or on the feet. This condition is generally caused by bacteria. Severe cases require medical referral. Hyprodrosis is characterized by excessive sweating caused by heat or generally body weakness. These conditions require medical referral. Malaria ruba, also known as prickly heat, is an acute inflammation disorder of the sweat glands, characterized by the eruption of small red vessels occupied by burning, itching skin. It is caused by exposure to excessive heat and usually clears in a short time without treatment. Recognize common inflammation and infection of the skin. As a barber, you will need to be able to distinguish between non-contagious and contagious skin inflammations and infections. Dermatitis is the general term for an inflammatory condition of the skin. The lesion may appear in various forms, such as vessels or papules. Irritant content dermatitis, abbreviated ICD, occurs when irritating substances such as chemicals or tints temporarily damage the epidermis. Unlike allergic contact dermatitis, irritant contact dermatitis is not unusual chronic if precautions are taken, such as wearing gloves and when working with chemicals. This condition is also called dermatitis Venatura. Eczema is an inflammatory skin disease that may be acute or chronic in nature and present in many forms of dry or moist lesion. Eczema is frequently accompanied by itching or burning. In all cases, should be referred to a physician for treatment. Eczema is not contagious and its cause is unknown. Psoriasis is a chronic inflammatory skin disease characterized by dry red patches covered with coarse, silvery scales. Psoriasis rarely on the face. If irritated, bleeding points can occur. It is not contagious and it is cause unknown. Herpes Simplex One is a recurring viral infection that produces fever blisters or cold sores characterized by a single vessel or group of vessels with red swelling bases. The blisters usually appear on the lips, nostrils, or other parts of the face and rarely last more than a week. Herpes Simplex 2 is caused by the same virus and designs below with the waist. Both forms of herpes simplex are contagious and require medical treatment. IV dermatitis is a skin inflammation caused by exposure to poison ivy, poison oak, or poison leaves. Blisters and itching develop soon after contact occurs. This condition may spread to other parts of the body by contact with contaminated hands, clothing, objects, or anything that was exposed to the plant life itself. If the plant oil, which can be irritating, remains on the skin, it also can be spread from one person to another by direct contact. Serious cases should be referred to a physician. Recognize pigment disorders and hypertrophies of the skin. Barbers are often in a position to notice changes in a client's skin, and it is important to be able to differentiate between skin pigmentations and hypertrophies. For example, a flat mole may look like a dark freckle, but if you see a change in the color or growth of the mole, bring it to your client's attention for medical follow-up. Identify types of skin pigmentations. Skin pigments can be affected by internal factors such as hereditary or hormonal functions, but by external factors such as prolonged exposure to the sun. Abnormal colorations known as dyschromism accompany skin disorder and are symptoms of many systematic disorders. A change in pigmentation can also be observed when certain medications are being taken. Because of photosensitive reaction related to use of certain antibiotics, the following conditions related to change in the pigmentation of the skin. Hyperpigmentation means darker than normal pigmentation, appearing as dark spots. Hypopigmentation is the absence of pigment resulting in light or white spots. Albinism is a hypopigmentation or absence of melanin pigments in the body, including the skin, hair, and eyes. Hair is silky white, the skin is pinkish white, and will not tan. The eyes are pink, and the skin is sensitive to light and ages early. Closama, also known as the mask of pregnancy, It's a condition characterized by hypopigmentation on the skin in spots that are not elevated. They are generally caused by cumulative sun exposure and can be helped by a dermatologist. Lesions. It's the technical term for freckles. Small yellow colored to brown colored spots on skin exposed to sunlight and air. It is commonly referred to as liver spots in older adults, although there is no relationship to the liver. Leukoderma is a skin disorder characterized by light, abnormal patches. It is caused by a burn, scar, inflammation that destroys the pigment-producing cells. Examples are vitiligo, nevus, also known as a birthmark, is a small or large malformation of the skin due to an abnormal pigmentation or dilated capillaries. Vitiligo is a hereditary condition that causes pigmentation spots on the skin that often appear milky white. Recent research suggests that this is a disorder, part of the autoimmune disease. Skin with vitiligo must be protected from overexposure to sun. As a barber, you can expect to see some common hypertrophies on your client's faces, scalp, or neck during a skin or scalp analysis. And hypertrophy of the skin is an abnormal growth of the skin. Many hypertrophies are harmless. However, if you see any changes occur, be sure to share your observations with your clients. Examples of common hypertrophies seen in a barbershop are as follows. Keratoma is an acquired superficial thickened patch of epidermis. A callus is a keratoma that is caused by continued repeat pressure or friction on any part of the skin, especially the hand and feet. If the thickening grows inward, it is called a corn. A mole is a small brownish spot or blemish on the skin, ranging in color from pale tan to brown or bluish black. Some moles are small and flat, resembling freckles. Others are raised and darker in color. Large, dark hairs often occur in moles. Any change in a mole requires medical attention. A skin tag is a small brown colored or flesh colored outgrowth of the skin. Skin tags occur most frequently on the neck and chest and can be easily removed by a dermatologist. A verrucle, also known as a wart, is a hypertrophy of public and epidermis. It is caused by a virus and is infectious. Verrucle can spread from one location to another, particularly along a scratch in the skin. A dermatologist can be helpful in removing and reducing the recurrence of warts. Skin cancer has become one of the most common cancers. It is also becoming one of the most common cause of cancer-related deaths because of the general complicity about prevention and lack of knowledge about the signs and real risks, particularly in young people. Barbers should recognize the signs of potential skin cancer and always refer clients. In this case, better safe than sorry is absolutely true. Do not let someone's young age or general good health stop you from being the one who saves someone's life. Early diagnosis and treatment. There are 3 types of cancers: basal carcinoma, most common and least served skin cancer, characterized by light or pearly nodules, and has a 90% survival rate with early diagnosis and treatment. Squamous cell carcinoma, more serious than basal cell carcinoma, characterized by scaly red papules or nodules. It can spread to other parts of the body. Survival rates depends on the stage at diagnosis. Malignant melanoma, least common of the cancers, but is 100% fatal if left untreated. Early detection and treatment can result in a 94% 5-year survival rate, which drops drastically to 62% once it reaches local lymph nodes.